So a lot of people haven't actually heard of lifestyle medicine. Lifestyle medicine is a new discipline, an emerging discipline within medicine that looks at 6 specific pillars and how we can use those 6 specific pillars to reverse, prevent and treat chronic health conditions. And when we talk about chronic health conditions, there's multiple ones. The big ones, and we've got an absolute huge pandemic of this at the minute, is obesity. We've got type 2 diabetes, we've got cardiovascular disease, so heart attacks, strokes, different cancers, chronic joint pains. And for me, I also think of hormonal dysfunction as part of the chronic conditions. And so what this discipline does is look at using the 6 pillars to try and prevent, reverse and treat these conditions as a first line approach. Because yes, there's going to be some people who do need medication, and that's absolutely fine. As a doctor, as a medic, it's looking at all the nuances, looking at that patient as a whole and actually seeing how we can improve the health and looking at the science behind how all those factors impact their health. One of the biggest things is actually educating patients on that. If you know what's wrong with you and why that's happened, then you've got a lot more empowerment and power to actually change things. And behaviour change is a fundamental aspect of lifestyle medicine. So nutrition's the first pillar. People think you are what you eat, and that is largely correct because that influences your health in so many different ways. Looking at nutrition is so important at looking at your lifestyle and your health. But as part of nutrition, I always think of gut health encompassing part of that as well, because those foods that we eat can influence that. Second one is physical activity, so exercise, and that's a huge topic in itself, looking at why people exercise, the different types of exercise people engage in. But I think one of the biggest things is actually understanding why people exercise, what the goals are. The third pillar we can think of is sleep. So are people getting enough sleep? How much sleep is enough? Lacking sleep, how does that impact your health? And it has a massive influence on your health, and it is linked with many chronic conditions. We need mental well-being to contribute to our health, because there is no health without mental health, and dysfunction within our mental state can massively impact multiple pillars. So for example, if we're feeling low or we're quite stressed, that can influence how much we eat and how much we exercise. So they're all kind of interrelated. I suppose one of the pillars that sometimes gets forgotten or not talked about enough, and it might sound quite obvious, but positive psychology and social connections, which is looking at positiveness and activities that we can do within that pillar to improve our mental health, such as gratitude, joy. Toxic substances people think of as just smoking and alcohol as toxic substances within our lifestyle, but there's so much more. It's what's in our environment, in our cleaning products, in our makeup, and what is in our food as well that we eat that can contribute to hormonal dysfunction and to ill health as well. Hi, thank you for watching my video. I hope you thought it was of value. Hit the like button and subscribe to my channel.